Now, from WYDC TV, this is Big Fox News at 10.
We begin tonight with a new warning about the highly contagious UK COVID-19 variant that's now rapidly spreading across the United States. COVID-19 specialist Amanda Decker tells us that researchers now believe it could be deadlier than previously thought.
A new study comparing the death rates among the different COVID-19 strains spreading around the world finds some new and disturbing information about that B.1.117 variant that originated in the United Kingdom. The problem, according to scientists, the death risk from that UK variant is, quote, significantly higher than it is with other strains. The study found it had 23 mutations in its genetic code, which is a much higher number than other types, making it about 40 to 70% more transmissible. And after looking at deaths across the United Kingdom since September, scientists discovered that variant is also 30% deadlier than the previous COVID-19 strain that first circulated in the U.S. Now, Florida has the highest number of UK variant cases with almost 700. But in Houston, an even more disturbing discovery this week. The health department began testing the wastewater treatment system for different COVID strains back in early February and discovered that UK variant was in 21 of the city's 39 wastewater systems. But as of this Monday, it's now in 31 of those treatment systems, which means the strain is already widespread. Right now in the U.S., the CDC has confirmed 15 cases of the P1 Brazilian variant in 9 states, 91 cases of the B.1.351 South African variant. That has now been confirmed in 21 states, but that UK variant is quickly becoming widespread coast to coast. Health officials warn these confirmed cases are only a fraction of the actual cases that exist across the country, with more than 3,000 confirmed already. Now, each vaccine manufacturer knows there are threats associated with the variants, and that's why Pfizer and Moderna are currently testing their shots against those variants to see if a booster shot will eventually be necessary. A fourth vaccine from AstraZeneca has proven effective against the Brazilian strain, but not the South African one. Vaccinations are picking up across the U.S., but officials say March is going to be a critical month. Wednesday, President Biden also announcing plans to secure another 100 million doses of the Johnson & Johnson shot, with the hopes of getting every American adult vaccinated as soon as possible. Now, so far, about 10% of the U.S. adult population has been fully vaccinated, but about 19% of the U.S. adult population has received at least one shot. But until more people get those vaccines, mask wearing, social distancing, hand washing, still extremely important as these variants continue to spread. I am COVID-19 specialist Amanda Decker reporting.
There are now more fully vaccinated Americans than there are confirmed COVID-19 cases in the U.S., and the vaccination effort continues to expand as more states announce reopening plans. Jonathan Siri has more from Atlanta.
More than 92 million doses of COVID-19 vaccines have now been administered in the U.S. The White House says about 70% of those in the most vulnerable groups have been vaccinated, including seniors and healthcare workers. And now access is expanding. Alaska is now the first state to offer vaccines to all residents 16 and up, as well as those who work there full time.
And we've been very fortunate that we've been able to protect our most vulnerable. And now's an opportunity for other Alaskans to get the vaccine.
About 10% of the country is now fully vaccinated, and health officials say we're on track to reach herd immunity by midsummer. But there are growing concerns about whether the vaccines will work against new strains. A study published this week found Pfizer and Moderna's vaccines are up to 10 times less effective against the South African variant.
Herd immunity will be available, but it'll be at a lower rate than might otherwise be seen against the original strain.
As the vaccinations continue, more states are starting to reopen, including Texas, which officially reverses pandemic orders on Wednesday, lifting the statewide mask mandate and reopening businesses at 100% capacity. But with less than 10% of the state's population fully vaccinated, some say it's too soon.
We have this light at the end of the tunnel, but if people start not wearing masks, then that distance could get longer and longer.
And President Biden is ordering another 100 million doses of the Johnson & Johnson vaccine after its successful rollout this week. In Atlanta, Jonathan Siri, Fox News.
Students will soon be returning to some sense of normalcy in the Hornell School District. They've announced plans to reintroduce students to the classroom. Matt Kleindinst is in Corning and breaks down those new guidelines.
Good evening, Scott. Under the superintendent's reopening plan, students will be back in the classroom for in-person instruction starting on Tuesday.
It's been a challenge, to say the least.
Nearly a full year has passed since the Hornell City School District started remote and hybrid learning. Now Superintendent Jeremy Polati says they're in a position to welcome students back to school full-time.
It'll be the end for those that are in person to remote learning as we've had it. We'll just be back to really what school is more traditionally like.
Students with North Hornell Elementary will be the first to be welcomed back into the classroom on March 16th. Bryant Elementary and intermediate school students will be brought back the following week. Plans are underway to bring high school students back as well. In-person learning will still look a little different under certain guidelines.
Social distancing will be in play. Face coverings will need to be worn in communal times, hallways, buses.
Polati says his staff have also had plenty of access to the COVID vaccine, making the prospects of reopening even better.
Every employee that has wanted the vaccine has it. And that's something we're really grateful for. That gives us that light at the end of the tunnel.
Polati is also grateful for the community rallying together to help students get through the pandemic.
We're moving forward, and we will continue to move forward because that's what we do. That's what we do for our kids. That's what we do for our community, and we couldn't do that without the support that we've garnered from all those that are involved.
Matt Kleindens, Big Fox, WYDC in Corning.
The White House COVID-19 response team announces plans to purchase an additional 100 million doses of the Johnson & Johnson coronavirus vaccine. That move is part of the Biden administration strategy to ensure that the U.S. has more than enough supply to vaccinate the entire population. The COVID-19 response team also says the most recent data shows a downward trend of coronavirus cases in the U.S., but does emphasize that the number of cases, hospitalizations, and deaths still remains too high.
CDC's most recent data indicate that the recent plateau of cases may be again starting to trend downward, with a 7-day average now of 56,000 cases per day.
The White House announced earlier this month that Johnson & Johnson will be teaming up with rival drug company Merck to accelerate the production of its single-dose vaccine. Some school districts are prepping safety plans for when students return from spring break this year. Katrina Nickel explains what they're doing and spoke to a doctor to get some recommendations for what you should do if you do plan to travel.
With spring break on the horizon, health officials are warning those with plans to stay safe because of COVID.
We see this light at the end of the tunnel getting brighter and brighter. I think I say that all the time. And we don't want to cause any bumps in that road.
With case numbers in Wisconsin on the decline recently, Dr. Burmeister says that doesn't mean now is the time to let your guard down.
Well, last fall, we went from a position that we were really similarly and compared to right now. And we saw, it only took a month or two to get into that sort of awful position that we were in November.
But if you are traveling, there are ways to do so safely, like by staying in state and driving, and remembering to pack your masks.
The lowest risk activity or transportation method is going to be driving with yourself or people who live in your household already. And then, the closer you are together with more people, particularly if they're not following those safety precautions, the higher risk they become.
Knowing families will likely be traveling over spring break, Green Bay schools will have a full week of virtual learning after their week off to prevent any outbreaks within the district.
They're just craving to get away and do some normalcy in their lives.
Green Bay Schools District Nurse Kristen Johnson says this gives them the best option to keep students and staff safe. Spring break is March 15th through the 19th.
People to get back and really assess their symptoms before coming back into school, not knowing if they're going to be traveling just within the state of Wisconsin, if they're going to be going to some of those higher tourism areas. And
all they ask of their students is
just log in, do your schoolwork,
and get ready to come back.
The Centers for Disease Control and Prevention will not be issuing updated travel guidance just yet. The agency says that will come once more people are vaccinated against the coronavirus. Right now, only about 10% of Americans have been fully vaccinated. The CDC recommends that people avoid air travel if they can for now. The industry group Airlines for America, though, insists that flying on a plane is low risk because of the heavily filtered air and federally mandated mask wearing. Next week is the annual spring burn ban across New York State. That means people are prohibited from burning debris in order to prevent wildfires. According to the Department of Environmental Conservation, that ban has cut down springtime fires by 43% since 2009. The DEC recommends residents wait a few months before safely burning any debris.
We understand that, it's a very viable option for people just to burn their debris, and all we want them to do is wait until that critical period when we've had our spring rains, when, the forest and fields have greened up and the danger of fire is lessened, and then they're free to go ahead and safely burn their debris.
Residents who have questions about what is safe to burn can call the DEC or their local fire department. The ban runs for about 2 months, from March 16th through May 14th. Still ahead tonight, a 93-year-old veteran is inspiring his neighborhood. In his case, it's a matter of showing discipline.
He's always been my hero, of course. They frequently tell me that he's inspirational to them also, and we're lucky to have really good neighbors. They keep an eye on him for us.
How he's still finding a way to serve, coming up.
Here's your local stock market update from Big Fox. Now, your Twin Tiers forecast from Big Fox.
Tonight's Big Fox forecast is brought to you by William Mattar. Good evening, everyone. I'm meteorologist Kim Walker with your weather update. Highs today topped out in the mid to upper 60s. Could you believe it? It felt like spring out there. Yesterday, we only reached the upper 50s for afternoon highs. So in Elmira, it was about 8 degrees warmer, as well as in Corning, 11 degrees warmer reported in Bath and also Watkins Glen this afternoon. The warm weather will continue into your Thursday. However, we do have another storm system that will be coming in, and that's going to put a halt to our warming trend. Here's a look at your planner for your Thursday. Temperatures starting off in the 50s, so a very mild start to our day tomorrow. We warm up to around 61 degrees already by 10, and then upper 60s could be possible in the afternoon. Moving into the latter part of the day, clouds will start to thicken up, and there's the possibility of a few showers. But overall, tomorrow will be unseasonably warm. But we do have another storm system that will come through, and it is going to bring cooler air for the weekend. Those temperatures will be a good 20 degrees cooler than what we're experiencing today. Not only that, winds will start to pick up as well, and it's going to make things feel so much colder. Our future radar is showing for tonight, clouds will start to thicken up. A few isolated showers could be possible, and then a few more showers during the day on Thursday. Not the best chances of rain. I'm expecting maybe a few sprinkles or very, very light showers. But then in the late afternoon into the evening hours, we have another round of rain that will come through, and it will bring the possibility of heavier rain at around 9 o'clock. It looks like some heavy rain could be possible from Corning to Elmira. Hornell could pick up a little bit of rain as well. But the system will be very quick moving, and it will be out of our area by early on Friday. So we're going to see a little bit more sunshine on Friday as well, but it's going to be a lot cooler. So here's a look at your forecast. Tonight, we drop down to around 44 degrees in Elmira, 47 degrees in Corning, and 44 in Perkinsville. So relatively mild. This is about our average high for this time of year. Highs tomorrow around 69 degrees in Corning and also in Elmira. Our extended forecast calls for a cooling trend through the weekends. 59 degrees on Friday, 42 on Saturday with plenty of sunshine. Clouds will increase again, but colder air will start to filter in. Those winds will also lighten up as well. Highs on Monday only topping out in the 30s, but we're going to bounce back closer to normal temperatures for the middle of next week with highs in the 40s.
More than 500,000 Americans living today have been diagnosed with lung cancer at some point in their lives. That's according to the American Lung Association. And now there's new guidance on lung cancer screenings in the U.S., suggesting current and former smokers should be checked every year and at an earlier age. Mandy Gaither has more in today's Health Minute.
When it comes to lung cancer, early detection is key.
Lung cancer screening legitimately saves lives.
And now there are new recommendations on who should be screened. The new guidance published in the medical journal JAMA now suggests current and former smokers between the ages of 50 to 80 who have a 20-pack-year smoking history should get screened for lung cancer with a CT scan every year.
Anything that expands the eligibility criteria to get more and more people screened for lung cancer, in my opinion, is obviously a good thing.
Dr. Michael Ward is director of the lung cancer screening program at the Ohio State University Comprehensive Cancer Center, James Cancer Hospital, and Solov Research Institute. He's in favor of the expanded eligibility, but says more people need to be aware that annual lung cancer screenings exist.
Maybe 3 to 5% of eligible patients for screening are actually getting screened, which is inexcusable in my opinion, especially when you have something as low risk and potentially high reward as this.
Dr. Wirtz says a vast majority of lung cancers are diagnosed after symptoms start, when the cancer is harder to treat.
The point of screening is to catch these cancers when they're very small, not advanced, and can actually be removed with a surgery.
Anyone who might be a candidate for a lung cancer screening should reach out to their doctor. For Health Minute, I'm Mandy Gaither.
A veteran in Rhode Island is still finding a way to serve, even at the age of 93. In his case, it's a matter of showing discipline in his daily routine. He walks more than a mile through his neighborhood every single morning like clockwork, rain or shine, and his persistence inspires those around him. Sam Reed reports.
Every morning in this North Kingstown neighborhood, 93-year-old Navy veteran Daniel Kershaw
Nice to have the sun out.
pounds the pavement.
That's my exercise, keep the blood flowing.
This grandfather of 8 lives on Cassandra Lane with his family.
He's not setting any land speed records anymore, but he's out there.
And never misses a morning to get out of the house to wish others well.
And he always waves, he always hears you when you're driving by, walking by.
Wearing a reflector vest with the help of his walker. He brings some Frank Sinatra beats to the streets.
I feel pretty good.
This is his favorite part of the day, and part of the reason he looks this good at 93.
I walk a little over a mile every morning, weather permitting. Rain doesn't stop me, but snow and the ice do.
Forced to temporarily stop walking twice from some pretty bad falls, he picked himself up and kept pushing.
So the neighbors missed him because he's kind of a fixture every morning, and they like that he's back out there.
Having served our country for 26 years, Mr. Kershaw knows the definition of dedication. It's a lesson of love his North Kingstown neighbors have taken notice of.
When I get up in the morning and I open my shades, and I kind of think about this, I'm like, it's a cold, rotten day. I don't feel like doing anything. And there I see Mr. Kershaw out there walking, and it really kind of inspires me to get moving.
He's always been my hero, of course. They frequently tell me that he's inspirational to them also. And we're lucky to have really good neighbors. They keep an eye on him for us.
Reporting in North Kingstown, Sam Reed, NBC 10 News.
In 2017, a Hawaii man born with a spinal condition was the victim of a callous crime, but the public rushed in to help him out. Now, he wants to help others with physical disabilities. Jim Mendoza reports.
Raymond Tavita was born with spina bifida. It helped when Schreiner surgeons corrected his foot deformity.
I got surgery to make sure that the foot itself stayed planted. Now there's nails in my foot that keep my toes and my feet like that.
He can walk, but only for short distances, so he relies on his wheelchair. In 2017, Raymond was a street performer, doing magic tricks in Waikiki when someone stole his wheelchair. Representative John Mizuno shared his story, and the public responded.
A few weeks later, we had over 25 donated wheelchairs, a couple electronic wheelchairs at that.
Raymond got 2 of them. The others were donated to people with physical disabilities, and it sparked an idea.
I realized that it became a service that I could provide for people.
With the representative's help, Raymond's starting a nonprofit called the Ohana You Don't See. He's asking for people to donate wheelchairs they no longer need so he can get them to disabled people who can put them to use.
I have a person that could repair things, so even if it's broken, we're just asking for any type of wheelchair that we could get for the community, so we could go ahead and distribute it out.
With Mizuno's help, Raymond's securing space where donated wheelchairs can be stored and repaired before they go out.
People can contact my office at 586-6050. And we'll be happy to help with the donations, making sure that there's storage for those wheelchairs that are donated.
Raymond is starting with wheelchairs, but he wants to help the physically disabled in many other ways so they can feel what he felt when people rallied around him.
It made me feel alive, like I was being seen.
To learn more about Raymond's wheelchair project, watch his live announcement Wednesday morning at 11 on his Facebook page, The Ohana You Don't See. Jim Mendoza, Hawaii News Now.
Goldman Sachs has announced plans to commit $10 billion in funding over the next decade toward advancing racial equity and economic opportunities for Black women. Called 1 Million Black Women, the new initiative will focus on areas including access to capital, job creation, financial health, and workforce advancement. The company is partnering with Black women-led organizations in an effort to better understand the barriers that Black women face. Goldman says the effort is the largest announcement of its kind in size and scope. A store in Germany is offering singles a fresh way to find love. The first Friday of every month is Single Shopping Day, and the supermarket is serving up new options to connect amid COVID. Customers who are interested can grab a numbered red heart balloon as they enter the shop. If there's a match, customers simply leave their contact details with the supermarket, who will help make that connection. The idea came from the owner of the supermarket and his wife, Sven and Sarah Stiegler, who announced the single shopping campaign via social media. A chance meeting ends with a new friendship and a priceless display of generosity. Jeremy Roth has today's Take a Look at This.
A pair of customers left an extremely generous tip for a restaurant server in Ohio, and it didn't just brighten her day, it helped solidify a heartfelt bond. It happened at a tavern in Independence where two widows were meeting for lunch. They told their server Tanya that they didn't cook often since they'd lost their husbands. Tanya revealed she too had recently become a widow, and the three women bonded over their shared experiences. When the bill of roughly $100 was due, another surprise was revealed. The pair left Tanya a tip of $2,021, bringing the total to $21,2121. An amazing display of generosity to remind her of a new friendship, of new beginnings in the new year. A pair of champions were immortalized in Pennsylvania as a statue of Joe Frazier and Muhammad Ali was unveiled at a gym in Feasterville. The event commemorated the 50th anniversary of the fight of the century. In 1971, the undefeated boxers squared off for the heavyweight title. Frazier won in 15 rounds via unanimous decision. The gym and Frazier's family hope the statue will help inspire future athletes. Hey, you know what's not inspiring? This bird's landing! This albatross went viral after botching its approach and face-planting in front of its offspring live on a nature camera in New Zealand. Aside from a bruised ego, the bird is fine, so what do you say we enjoy an instant replay, this time with sound effects?
Blip, blip. Whoa! Guy who turned off the lights with this landing that is hurting the face.
For Take a Look at This, I'm Jeremy Roth.
We want to leave you with a smile tonight. A grandmother in New York was given a prescription to hug her granddaughter after getting the second COVID-19 vaccine. The doctor made the prescription for Evelyn Shaw, reading, quote, "You are allowed to hug your granddaughter." It was Shaw's first hug in a year, and that tender moment was recorded on video. The granddaughter said she arranged the whole thing with the doctor, even sealing the prescription in an envelope. Thanks so much for joining us. Have a great night.